Hi, my name is Trinity Puno, and I am a current undergraduate student here at the University of Nevada, Las Vegas. My ultimate goal is to become a physician, as I have found that it's the perfect blend of social work and science. I'll be completing my Bachelor's of Science in Cell and Molecular Biology with a minor in psychology this upcoming spring, and being a physician essentially gives me the best of both worlds. However, I do want to have more of an understanding in public health, specifically sexual and reproductive health among minority populations. One of the questions that I would like to study during my time in graduate school is what kind of behavioral practices lead to poor fertility or infertility, and then how can we decrease these among those with limited access to healthcare and other resources? This interest in public health was actually sparked after having the pleasure of working in Dr. Rainier Laboro's research lab, where we work with community partners here in Las Vegas to determine the barriers that minority populations here face when accessing their health care. Having these community partners allows for a collaborative study, making the research much more meaningful to them. Not only did I learn about the research process and the influences of healthcare of the people of Las Vegas, but Dr. Laboro helped me gain social confidence as well. I was actually extremely timid during most of my time as an undergraduate student, but thankfully he taught me the importance of mentors and the importance of taking control of my own education, ultimately helping me come out of my shell. I've learned to ask for help when I need to, and that no question is truly a dumb question. As a physician, I hope to foster the same relationships with my patients and teach them how they can always come to me and ask me for help as well. I've learned a lot on campus, both in the classroom and in the lab, but I've also gained important experience outside of the classroom. I have been a full-time student at UNLV while also working part-time as a medical scribe at the emergency room and Sunrise Hospital. During my free time, I've advocated for pediatric cancer and victims of child abuse, and I've been involved in a pre-medical club. With these organizations, I've learned that the American healthcare system needs reform, and Las Vegas specifically needs more specialists. Pediatric cancer needs more research, and victims of child abuse need specific programs to prevent long-term consequences. Luckily and thankfully, these issues are all being addressed by current grad students and those who have graduated, and physicians definitely play their part in solving these problems. One day, I hope to lend my own helping hand as a doctor here in Las Vegas. I know that graduate school will give me access to even more mentors, helping me grow further not only as a student, but also as a person during my early 20s, which is a critical time for preparation of anyone's future. Learning how to juggle my time with various activities and schoolwork here at UNLV for the past 4 years definitely hasn't been easy, but I know that I've adequately prepared myself for the rigors and demands of graduate school, and I'm excited to challenge myself even further. Thank you.